Thanks, guys. Now, being a parent can be really stressful, especially when your little one gets sick. When they've got a pain or a fever, you do anything to make them better. But it is vital to be medicine-wise when you're dealing with pain and fever in little children. So this morning, as part of our Be Medicine-Wise campaign, I'm at North Bondi Playgroup with Dr. Danielle Stovasser from NPS to discuss medicine-wise ways with little children. Good morning, Danielle.
Hi, Ginny. Parenthood is hard enough without having to worry about pain and fever in little children.
Especially in the middle of the night, often your first instinct when your little one's unwell is to head just straight for the medicine cabinet.
That's right. And unfortunately, small mistakes in doses can mean big effects in little bodies.
Pain and fever medicines can be so confusing. So your first question is going to be, do I need a medication at all? If you've really gone through every non-medication option, the next question has to be, which medication do I use?
So the choices are ibuprofen and paracetamol for children, and they're in many over-the-counter preparations and cough and flu medicines. So people would not be surprised to hear that they're the most common medicine for children under 15 years of age.
That's right, and so many parents are horrified to find out that the #1 cause of children under 5 landing in hospital due to an accidental overdose is paracetamol.
That's right, and even ibuprofen itself can have side effects in normal doses, so it's important to use them wisely.
Okay, so if you've decided to use a medicine, what are the medicine-wise steps to take to keep your child safe?
The first thing to do is to check the active ingredient, know where to find it. It's the small name written in the small print underneath the brand name, and then to look out for things like the different strengths and formulations.
Really good point. You've got to read the packaging because there's just such a huge variation, not only between brands, but within the same brand, different formulations can be very different. So read the packaging carefully.
That's right. Most of the packages have doses in both ages and weights, and we recommend that you dose by the weight.
Now, when you've got a little baby, often you do know their weight because you're at the clinic all the time, but for older children, it can be easy to lose track. Anyone who's tried to get a little toddler to stand still on a set of scales knows it's an absolute nightmare. So one good way to do it is to actually stand on the scales yourself, write down your own weight, then pick up your child and weigh yourself again. Subtract the smaller number from the bigger number, and that number left is your child's weight. Use your child's weight to calculate the right dose, but that's only the first step. Then you need the right equipment.
That's right. So inside the boxes there are usually some devices, and we recommend that you use an oral dosing syringe. And there are 5 steps that we recommend that you use to make sure you get that dose correct. The first thing is to put the bottle on a hard surface after you've shaken it, and then put the syringe inside the bottle and draw it up to the required dose. Then take it out of the bottle and invert it the other way, expel any air, and just check that that dose is right before gently putting it inside the child's mouth and squeezing it into their cheek. There may be more than one parent or carer looking after the child, so it's important that you communicate so you don't accidentally double dose, or even write it down if you need to.
All great tips, Danielle, but sometimes things do go wrong. So what should you do if you suspect you might have accidentally given your child the wrong dose of medicine?
Even if you're not sure, don't wait till you get any signs or symptoms. Immediately call your doctor or the Poisons Information Centre on 13 11 26.
Great advice. Always go to the experts.
That's right.
Dr. Danielle Stovasser, thank you so much for joining us today. If you want more tips on how to be medicine-wise with your children, go to nps.org.au. Guys, back to you.